You answered a question that I had already, and that was if you're in therapy and you are talking about things that are painful, trauma that you might have suffered either at the war or at home or whatever situation you were in that really made an impact in your emotions, and you're talking about these things, that I would think that there would be a conflict in the brain with the chemistry that the emotions bring about, while Alpha-Stim is trying to regulate that. And it's fascinating, but I'm not quite sure I understand the whole process.
All right. So speaking neurologically, the nervous system is electrochemical. And in Western medicine, we focus on the chemistry. We focus on the neurotransmitters. We focus on the brain chemicals, all of that. And that's important. I'm not saying it's not. But the chemistry is controlled by the electrical components. So, the way a nerve cell works, an electrical current travels along the body of the nerve cell, reaches the axon terminals, the receptors open up, the neurotransmitters flood into the synapse. They, activate the receptors on the other nerve cell, build up a charge, and then that charge fires down the next cell. So the types and the amount of neurotransmitters that go into a synapse are at least somewhat dependent on the intensity of that electrical charge. And fMRI studies have shown different imbalances in the electrical functioning of the brain that we can tie to different emotional states. So for example, with depression, symptoms of depression are ruminating, turning inward, kind of lack of activity, lack of social things that seem as fun or as enjoyable as they that you used to enjoy. They're not as much anymore. And what they found with depression fMRI studies is that the parts of the brain that are involved in that ruminating and looking inward and it's just kind of feeling down and sad are very hyperactive, while the parts of the brain that are active when we're very social and outgoing and engaged and doing things that we enjoy doing is very underactive. And it's the same thing when you're talking about an experience. So if you're talking about an experience that makes you anxious or scared, that part of the limbic system, those parts of the brain get activated, and that electrical, and your brain starts firing those electrical signals. If they're firing too many electrical signals, if those areas are overactive, then you're going to feel that emotion even more intensely. Whereas with Alpha-Stim, all we're doing is balancing the brain. So we're sending a wide range of biological frequencies that activate the nerve cell receptors and either stimulate or inhibit the nerve cell activity, depending on what needs to be done. And the nerve is the one that decides that. So if a nerve is hyperactive, it's not going to respond to frequencies that would make it more active. It's going to respond to frequencies that calm it down, and vice versa. So in therapy, as the cell starts to get, those cells start to get really active and those parts of the brain get to be, kind of hyperactive, if they have the Alpha-Stim on at that time, it helps to bring that back down, and they're able to still feel the emotion. It doesn't completely flatline it. It doesn't make them an emotional zombie. They're still able to feel it, but they feel it at the appropriate level. And instead of being flooded and overwhelmed by it and kind of, having their sympathetic nervous system activated to the point where they just can't function anymore. Or they just want to, run from the room or, defend themselves. So Alpha-Stim helps to balance all that out and lets them get through it.
Would you say then that, would it be fair to say that Alpha-Stim works similar to an adaptogen? Like L-Theanine, for example. L-Theanine in green tea is known to bring down cortisol and perhaps supposedly it increases alpha brain activity when taken regularly. Would you say it's similar?
So that would be a good comparison, I believe. We do have EEG studies that show Alpha-Stim can increase activity in the alpha wave frequencies, kind of induce that alpha state, that relaxed, calm, kind of tranquil feeling, but also tends to decrease delta wave activity, especially in the frontal lobe right here behind the eyes, so that you feel very alert and focused. But there again, we've also have studies that show if people started with high levels of alpha activity, by the end of the treatment, that alpha activity has actually decreased. So it's not forcing a specific response. It's not forcing a specific, it's not inflating alpha activity regardless of where the alpha activity starts, if that makes sense. It's literally just bringing it into that zone where you're in the alpha state.
Is the patient more suggestible at that point? It's like a form of, would you say, electrical hypnosis?
No, I wouldn't say that. Their defenses were down, so they were more able to participate in the therapy process. So, for example, in one of my PTSD groups, I had a veteran who, great guy, loved him to death, but he was the class clown. So if things got really heavy, really intense, I could almost set a watch by the fact that he was about to say something humorous and inappropriate to kind of break the tension. And that was his way of coping with things when he got uncomfortable. Right. Worked with this man, with this group actually for years. And then one day he came into group. He was about mid to late 40s, I would say. And he'd had like 5 back surgeries by then. He came into group one day and it was a bad pain day for him. He was just moving very slowly, walking hunched over, barely moving, kind of shuffling his feet. And one of his fellow group members had brought in an Alpha-Stim that the VA had just sent him through neurology. And he didn't remember having gotten it. He didn't remember talking to anybody about it. He just walked in and he was like, "What is this?" And I was like, "Oh, it's the Alpha-Stim." I didn't have one in my office at the time yet, so I was kind of all excited to see one. And he was like, "I don't know what it is. I don't know how to use it." And neurology had helped another veteran get one, and so he knew how to use it. So he was like, "Oh man, I'll show you how to use it. This thing's amazing." And the guy who brought it in didn't want to, but this guy with the class clown and the bad pain that day was like, "Hey man, I'll try anything." So we put it on him, and I noticed about 5 minutes into it, he just kind of sank in his chair and was just very calm. And then I noticed that he was engaged in therapy. He was making comments. He was helping, respond and help people. But it was all 100% on point, not at all distracting, not at all his normal behaviors. And I'm like, okay, that's interesting. I didn't have a lot of experience with Alpha-Stim at the time. So then we finished the treatment. He only needed a 20-minute treatment. And, took the ear clips off. The guy who brought it in was like, "Okay, yeah, I'll try it." So we put it on him. At the end of the group, about 30 minutes after his treatment had ended, this man stands up, looks really confused, and sits down. And I'm going, "Dude, what's up?" And the whole group stopped because this was a very close-knit group. They all loved each other, supported each other. It was amazing to watch all of these veterans come together and support each other. That's one of the reasons I did so many groups. I love seeing that dynamic. So they, of course, all stopped to see what and what in their minds their brother needed. And he stood up and he kind of stretched and he stood up really straight. And he was like, "Guys, my back doesn't hurt." And I was like, "Really?" And he goes, "Yeah." And I'm like, "Well, I said, how are you feeling emotionally? Because you weren't a cut up in group today." And he's like, "Yeah, I feel really calm and relaxed." And I'm like, "Okay, great." And so then of course everybody wanted one because,
Right.
So I have seen that where like their defense mechanisms won't be as high. And so they're more engaged in the process, but I wouldn't say more suggestible.
I see. So years ago, I was working in Wilmington, Delaware, where I worked in outpatient clinic for substance abuse.
Hmm.
And I was doing auricular acupuncture at that time. And there were some patients that began to say that they were having hallucinations after the treatments. I don't know why, but they were saying that. So we had to kind of monitor who would be more susceptible to maybe, even if it was in their mind fantasizing that, we had to watch out who we did these treatments to.
Right.
Who would not be a good candidate for Alpha-Stim other than someone that may have a pacemaker or something like that?
That's really about it. So somebody with a pacemaker, a defibrillator, maybe a cochlear implant, that's the only contraindication for an Alpha-Stim. Other than that, it's a very gentle treatment. It's a very safe treatment. Our side effect ratio is 0.11% of the time over the last 10 years. And I know that because I'm the one who runs those numbers. So as of last year, at the end of last year, we'll see what the ratio is this year. But when you look at, number of units that we sell versus number of adverse effects reported to us, it's an extremely low number. It's at 0.11%. We've never had a significant or serious adverse reaction ever reported. We've never had to report anything to the FDA, which, you report to the FDA when there's a serious injury or they have to go to the hospital because of your treatment or something like that. We've never had to do anything like that. What we do tend to find is people may have a little bit of dizziness or headache after treatment. Generally, that's because they had the current turned up just a little too high. If they'll put the Oculus back on, turn the current down, let it run for a few minutes, then that headache or dizziness will go away. A couple of minutes after that, they can turn the device off. So other than that, we're effective for about 85-90% of people who try it. One survey we did recently showed about, and again, depending on what indication we were treating, anxiety, depression, insomnia, or pain, but the range was between 85 and 94% had at least a 25% improvement in their symptoms.